Sometimes things don't go to plan. For all the best planning in the world, things can change. And one of the things that does happen at times is that the mom has developed a great relationship with her doctor or midwife and is very disappointed to hear that during the time she's due to have her baby, that doctor or particular midwife won't be available as it's in the holidays or they'll be off. And under these circumstances, I would just encourage you to ask if it's possible to meet their stand-in beforehand if you're feeling a bit uncomfortable about going with someone new, and also to try and accept that all of your doctors and all midwives, hopefully, are very, very well trained and no one is going to put you or your baby at risk. If you think this way, then you're going to allow the baby to come at a time when he or she is ready. A lot of people like to ask for an induction just so that they can have the doctor they've chosen. And when you have an induction, you need to keep in mind that almost 50% of inductions do end up in a C-section. One of the reasons for that is that the baby isn't ready yet to be born, or not in the position it needs to be, or perhaps it's just not the right time. So we don't want moms to be requesting inductions simply for the reason that they're not going to have their chosen doctor. A good reason for induction, however, would fall under one of the following 5. If you have pre-aclampsia, or perhaps better known as high blood pressure, if you are suffering from gestational diabetes, there may be the risk to the baby and the mom, especially if it's a very large baby, or if the mom is unwell and the diabetes is not well controlled. In a situation where the amniotic fluid surrounding the baby is not sufficient. So if your doctor's done a scan and said that I'm not happy with the amount of amniotic fluid, and of course we need that amniotic fluid to protect your baby, then they may recommend an induction. And in cases where the placenta is not working well, so we call it calcification of the placenta, or a placenta that just isn't doing what it needs to do, then there may be discussion around induction. And of course, in situations where the mom is very unwell and perhaps has requested an induction. The reasons not to do an induction are post dates, because a lot of the moms seem to be given a due date and think that the baby will come on that due date. If I could just encourage you to bear in mind that probably 5% of babies come on their actual due date that you've been given. The rest may come 2 weeks before, 2 weeks after, and in a first delivery, more likely slightly after. So the question is, how long do we wait before we get worried? Well, if baby's happy in his beautiful warm place close to your heart, the uterus is an amazing organ, it's protective, and the baby is safe within that uterus as long as there's enough amniotic fluid, the placenta's working well, and the mom is healthy. In other words, good blood pressure and clean bill of health at her checkup. If you are wondering what to do if you go past your due dates, the best is to chat to your doctor and midwife, because more than likely they'll want to monitor you much more closely and discuss how many days you're willing to go. In most of the world, the accepted norm would be 7 days, providing all is going well. Some places will go as far as 14 days. I would encourage you to just chat to your doctor or care provider and find out if everything's going well, where do they stand with this. We don't encourage induction just because you're having an event on that day or your doctor might be away, because once again, babies do come when they're ready. There's some evidence that suggests they secrete a substance from their lungs that alters the progesterone levels in the placenta and kick-starts the release of oxytocin, which is the key hormone to drive the labor. If we start interrupting this process, it's very easy for things to change and not go according to plan. If you have decided to book to have an induction, it is best that you ask if you can come in early morning. We do find that the moms who are asked to come in at midnight or the night before do find it a little bit anxiety provoking that they're in the hospital in the night time and we can't really imagine when everything's going to happen. They don't always have their support group around them. So I would suggest asking if you can come in early morning and then the night before just to go to bed nice and early and have your bag all packed and ready, and just make sure that you are prepared, especially mentally and emotionally. And to help you do that, it may be of huge assistance if you book yourself a doula who can help you along that way. When you go in for your induction, you can discuss with your doctor what method of induction they're using. Very often they would insert some prostaglandin gel into the vagina, and that gel will probably start the uterus with contractions. The tricky part with induction is that sometimes they don't take, so you might be asked to come into hospital, and if nothing changes, you may well be sent home. But if things do start happening in terms of contractions and things moving forward, you'll be asked to stay, and they would be monitoring you, and hopefully some progress will be made within those 12 hours. There is talk of women going to their doctor and requesting a membrane sweep or a stretch and sweep. You may not know that terminology, but really it's where the doctor or the midwife would do an examination, and they would actually do quite a vigorous examination where they're trying to stretch the cervix as such to help kickstart labor. We would encourage you to not do an induction unless there's a very valid reason, as I've discussed earlier. It is a personal choice, and certainly it would be respected if you are requesting out of personal reasons. But it is not an ideal way to start labor, because we would like you to go into labor with really high oxytocin levels and have your body as prepared as possible. There are other types of induction. You may have heard of artificial rupture of membranes, which is where you will be vaginally examined, and if the doctor or midwife feels it feels like a balloon in front of the baby's head, they may say, let's rupture these membranes, and that will help the baby's head to come down quicker and put pressure on the cervix, and usually things do progress quicker after that. When they're doing artificial rupture of membranes, they're using what looks like an amnio hook, just to hook those membranes, not your vagina, not the baby's head, and that will help things to progress and move on a little bit quicker. They will then ask you to stay on the bed and to be monitored very closely, as once the membranes are ruptured, we need to make sure that the baby's doing well, and if the head was high, there's a risk of the umbilical cord falling in front of the head, and we would have then a cord prolapse where the baby head can actually press on that umbilical cord, and it can become an emergency. So of course we need the umbilical cord to provide oxygenated blood to the baby and giving the baby life. So if that's closed off, it's very, very dangerous. We also speak about artificial rupture membranes when the mom is in established labor, and it can also be done at those times to help things to progress a bit quicker. What we're looking out for in that case is that the amniotic fluid is a straw color. So if you ever have amniotic fluid draining out of your body and it is not straw colored, if there's blood in it, or if it's a dark brown color, it could show distress. So if the baby's in distress, it will poo in utero, and that meconium dark black tar-like poo will cause the amniotic fluid to change color. So if you are, for example, even if you're at home and your waters break and it's not as straw coloured, you should go straight into hospital. And under those circumstances, we would expect you to deliver within 24 hours. And the reason we'd like you to deliver within 24 hours is the risk of infection gets higher and higher the longer we wait. So if your membranes have ruptured, or perhaps you'll be more familiar with the word waters have broken, or a gush of water, you would then need to go into hospital and deliver within 24 hours. Another form of induction is where you are given an intravenous line, so a IV infusion is commenced, and into the fluid that's running in, they will put some medication, a synthetic form of oxytocin, and that is to help the contractions to be stronger and more regular. And that medication is given at a recommended dose, whatever the doctor has written up, and it is monitored very closely by the midwife or the on-call person who's monitoring you to make sure that you're not hyperstimulating or overstimulating the uterus. So if your contractions are one on top of the other and you're finding it hard to cope, I find a lot of the moms who are having inductions, especially with the use of pitocin via the IV, tend to ask for an epidural. It's very, very tough to have a contraction on top of the other when you haven't been eased into it. And that's one of the reasons we would prefer moms as much as possible, and if their health and the baby's health will allow it, to go into natural labour and to birth as naturally as possible.